What's up guys, Dr. Ricky back for another video, Skin Decisions. We hit 400K today, 400K. Thank you so much. Let's jump into this video.
I want to actually look at my face. People stare at me a lot. Me and Nears don't get along. I was hit by an underage drunk driver. Then the trenches a little bit, fought, got back up, and just
Drinking and driving, man. No bueno. It's not always about just cosmesis for the cosmetic reasons like enhancing breasts or doing other things like liposuction. Like this guy had a car accident and he's not confident and he wants to look his best because he wants to feel his best. So I think that's a reasonable way to go. Let's see what happens here.
I'm Dr. Sheila Nazarian, a board-certified plastic surgeon. My philosophy is to deliver natural
Beverly
results
Hills.
to men and women to give them their confidence back.
But cosmetic procedures are no longer limited to going under the knife. I'm Nurse Jamie, one of the world's top beauty and skin experts. Whether it's surgical or not, our goal is for people to look in the mirror and feel good in their own skin.
Why don't you tell us a little bit about what brings you here?
people stare at me a lot. And normally on their open book, I have no problem telling them what happened. Then I've had some people where they're just stare at me 24/7.
Yeah, it's tough.
I watched one lady walk into a wall. It's hard to look at your face when it's all mangled up.
Yeah, having to relive it over and over and over is got to be really mentally tormenting for a lot of people. So I think something that's great to talk about right now in my practice, I have a mental health specialist. They work with my patients who are struggling mentally from something traumatic or something they're stressed about. And so while they're going to fix his skin and work on that, I think taking care of their mind is just as important.
I was actually riding my bike home from a friend's house, and this night was different than every other night. Because I was hit by an underage drunk driver that failed to yield, was texting while driving, and hit and run. When I impacted her vehicle, my lower jaw from jaw here to here was all ripped off of my face. Broke several areas of my neck, as you can see from all my scars. And I actually had my hip pulled out of my body. I shattered these 3 fingers were basically powder. I broke both my shoulders, both my forearms.
Devastating.
In the hospital, I was in a coma for 9 days. Last I remember, I was in the ICU for a total of 11 days. And my total prison sentence in a hospital was 49 days. And it was bad.
Pretty devastating, guys. Like you can see, texting while driving and obviously drinking and driving. These leave crazy internal scars for the rest of his life.
My bike racing career was gone. Like any veterinary work and training of animals that I did, I couldn't actually do it.
So sad, the mental
because my
toll this
arm
takes on
and my
people.
shoulder were so weak. I suffered a lot
Back
of
pain,
mental illness as
hand
well. I suffered
pain.
from PTSD with agoraphobia, major
PTSD.
depressive disorder, major panic disorder, and just general depression and anxiety.
Yep, he probably has
This
flashbacks all the
bad
time.
experience. It kind of does suck that it happened, but I'm able to use this to help people and to help end drunk driving from the front lines.
So what are some of the things I think that they're going to focus on? They might be able to do some filler to restore some volume to the lip, some type of flaps to improve volume in the lip, and also to just release the scar around the mouth, which sometimes they just need stretching exercises to do that.
My smile does tend to hurt, tends to cause pain.
He also has some skin, some weird scar and skin reactions from the trauma there that maybe dermabrasion or something would help, and possibly laser.
So with him, he's got a lot of stuff happening.
Yes.
So they're gonna make their plan now.
Scars in many places.
Yep.
And what that requires is getting a little triangle of skin from the upper lip, attaching it to the lower lip. They stay like that for weeks, so that little triangle gets blood supply from the lower lip, and then you detach it from the upper lip.
Break. We commonly do those flaps trying to fill in soft tissue defects like that. The problem with an Abbey flap on this guy that would worry me is that when you take that triangle of tissue from the top lip and you rotate it to the bottom, yeah, you're bringing more volume, but you're narrowing the oral opening more, and that can make it worse.
Problem with him is he doesn't have much of an upper lip either.
It's already slightly contracted.
It's already
Boom.
contracted. Surgery is just not going to be the answer for
Yeah,
him.
exactly.
It's a lot to go through, and if I can't
Dang, I do know what I'm doing.
amazing result, I'm just not going to put them through it.
Yeah, not worth it. This is gonna be a largely non-surgical maneuver here. Maybe some scar revisions on the neck. That could be
I
surgical.
think I could do a lot non-surgically.
Louis
Yeah.
thinks the only thing that we could do is give him his smile back.
Yep.
It's all about restoring
Exactly.
balance to his face, starting off with his smile. So I want to bring in a dentist. It's important for Louis to do the dental work first because
Yeah.
I need to see how his lips fall over the teeth before I can start to work on the skin. Another
Exactly.
thing is I want to do some cosmetic.
Yeah, I alluded to that before, that he had a lot of gingival show because he has lack of tissue. So getting the dentist in is great. I'm guessing he has some false teeth in there. They're going to do some dental work to really see then what she needs to do to put in filler or do other things to actually create volume to cover the gums up a little more. Sometimes a little Botox to paralyze or freeze some of the muscles. We do that for what we call a gummy smile all the time. So people who have a gummy smile where their gum is showing a lot, you can do a little bit of Botox to weaken that muscle. It's a delicate balance, but it does really make a huge difference when done well.
Cosmetic tattooing is often used.
Yeah, I didn't
for
think about
cosmetic
that. Tattooing,
using
amazing.
it to restore his lip line and
Yes.
even out the shape of his lip. Then
Yes.
we would add injections of hyaluronic acid in
Yeah.
order to restore facial symmetry. And lastly, a combination of lasers will really help to minimize the
Absolutely.
severe scarring across his forehead, face, and neck.
I think you can make him better with
His neck, I'll say, we'll see what happens with this. I would almost offer him some scar revisions in the neck because I feel like depending on how loose his skin is, you could probably really improve those wide scars, but who knows, maybe the laser will fade it. Always a good idea to start with the non-surgical and then move into the surgical.
The best way to approach this is probably non-surgically. It's going to be less
Yeah.
painful, less downtime. It's not going to set you back.
I agree with
as much
that.
as a surgical result would. I don't think that surgery is going to give you such a huge difference that it's worth going.
We'll see what happens with the neck scars. I would potentially down the road offer him some for
Then the
that.
right side. So I want to take this piece down for you and this piece down to make it more even to the other side. It's about restoring balance. You have a great face.
I know, I'm crooked all over.
The coup de grace here.
He's got a great sense of humor about it. I'm sure it took a long time to get there for that. And guys, sometimes these are done over months, stages. Do a little bit, see how it goes, how it reacts, and then come back and do a little bit more. It's a tough case.
We're going to provide Louis with a brand new set of teeth. This is going to be life-changing for him.
Yeah.
So this is you, Louis.
The mouth restoration is going to be huge.
There's been so much damage through here and tooth
He
line.
probably had jaw
When you look up,
fractures.
There's going to be some teeth there.
On top
Yeah.
of it, we know that your bite doesn't fit together very well. So we're going to re-engineer how the lock and key fit of your bite is. For
Yeah.
the first time, you're going to be able to chew your food, going to be a lot more comfortable as well.
You can do all that today.
All that.
All right, he's going to get a little bit of IV anesthesia, which is awesome. Hopefully they have an anesthesiologist for that because Jackson didn't, and that didn't turn out very well. So yeah, dental restoration is huge. I'm excited to see the dental work they get done here. Let's go.
Look at that! I'm so excited. We're going to get your smile back. It's
Yeah,
back.
this is going to be awesome to see what she can do for his smile.
Dr. Marashi did such an incredible job on Louis's teeth. This puts me in such a better starting position.
Yeah, these injectors who are good at what they do can just do amazing work.
Resurfacing, adding volume to where you have this scar here.
Yep.
That is dented in, and that's part of the reason that this comes down. So I'm going to raise this, and then I'm going to add some filler, and we're just going to restore some symmetry to the face.
Cool.
Today, I want to prioritize two things: scarring and symmetry. For Louis's scars, I'm using the Alma Clear Lift Laser.
Cool.
What this laser does, it hits the pigmentation on his scarring,
Yeah.
fragments it into tiny little particles, and then your white blood cells carry them away like little Pac-Man.
Yeah, so the white blood cells are scavengers, and they take away some of that bad
Scars are not easy to treat
pigment.
no matter where they are, but I find that on the face they're a little bit easier because you're more vascular, there's more blood flow to the head, so it heals faster and a little bit nicer. Restore the volume, restore the symmetry.
So I can't see what she's using. Oh, that's-
That's
a hyaluronic acid filler.
Injections of artistically placed hyaluronic acid will really help to restore
Yeah.
his proportion.
So hyaluronic acid fillers are the ones that you really, really want, guys. Hyaluronic acid is found throughout our skin and our body, and we have a normal enzyme that breaks it down. And that's why these fillers that are HA fillers, we call them, are so good, because if we do inject it somewhere that's not, you don't like the way it looks, or if you get vascular occlusion, we can inject an enzymatic medication to dissolve it immediately.
This is a brand new system. It has this fancy little gadget on it just for small areas like ears, but for you, we're going to customize it for that little circular patch.
Yeah.
After his accident, the
If they could
priority
soften up that
are
patch up there,
sitting back
that'd be
together
great.
in order to save his life. The way that they approximated the wound above his lip created an indentation, which makes it really hard for him to shave there.
Yeah.
It's attracted to the pigment in the bulb of the hair, and so it destroys the hair so it cannot regrow. So it's a permanent reduction.
Okay, cool. So they're basically getting rid of the hair because that's a tough area to shave, which, yep, I've seen that before. It's super tough.
And you can only treat the hair when it's in the anagen growth cycle. That's when it has the most pigment. It's usually a series, so I'll have to do it more than one time. All right.
All right, 1 month into treatment. Let's see how things are going. It generally just takes time for these things to get better and better.
And the results are looking great so far.
Let's check it out.
Hey!
So scar color should be getting better.
Wow.
Softness.
Myself in the mirror now.
Oh my gosh.
Aw.
That's going to make me cry. I love it. I'm so happy.
That's awesome.
Okay, let's get started.
Y'all, this is the ultimate feeling when patients come back happy and treatments are going well. It makes us happy.
Scar tissue. I also want to tackle the shape of Louis's lip and improve the neck scars.
Okay.
For Louis's neck, I'm relying on my dye-VL laser. So you'll sense it through the surrounding tissue even though your eyes are protected. If 10 is the worst pain you ever had, what would you put this as pain-wise?
The first one thing that I don't feel nothing right now.
Yeah, most of these lasers
It produces an extremely
don't hurt too
bright
bad.
light that will help me to break up that redness.
Yeah, there you go.
without disrupting the surrounding tissue. Feel like
Yeah,
this
that's
is
so what I
like-
was going to say is this laser is really, really good for, you could see that the red vessels that were supplying that scar with blood supply were sort of regressing. And that's the reason scars are for up to 1 year is they're hypervascular because it takes scars 12 months to mature. Initially in a wound, scars get laid down, the collagen is all jumbled. And then over the course of a year, when you're in the remodeling phase, you start to reorganize into flat sheets of collagen. And that's when the scars flatten out and get softer. Well, this helps suppress some of the vascular supply that's making them so red, but it doesn't really inhibit the reorganization process.
by like 30% just right before my very eyes. Thanks to Dr. Marashi, Louis has a great set of teeth.
Yeah.
But the other half of the smile is in the lips. Just to kind of restore
build those
the
lips
shape of the
out.
lip, we're going to do the cosmetic tattoo. You can see that suture line.
So a couple options here would be to put some filler in his lip, or what she's doing is a cosmetic tattoo. So why is she choosing the cosmetic tattoo? The reason is the red portion of his lip is partially missing and you can't really replace that. So she needs to actually reestablish that anatomy with some tattoo, and then she could give some volume back with filler. Let's see if that's what she does.
I need a bump there and a bump here. It's basically using cosmetic tattooing in the same color of his lip to kind of bring
Yep.
out that line a little bit more.
Yeah, it's called the
This is
white
kind of
roll,
his lip color.
where the red and the white lip
Here we
meet.
go.
This can sting a little bit
Oh my God,
for sure.
I love this. A little bit more on the bottom, and then that's good. Okay, I like it.
Pretty cool, huh? This guy's starting to look good, a lot different from where he was. Can be really, really hard. Guys, these are never perfect, but what we're trying to do is to get back to as close to normal as we can, as well as restoring function, which is really huge. 2 months, this should be a big checkpoint. 3 months is the time where I tell people you can really see the differences.
Not deal for fiance and
Aw.
not look like a ogre when I'm out with her, looking like a guy that does look like they deserve that beautiful lady. on
That's
their side.
awesome.
That would be a beautiful thing.
Oh.
Yeah. Me and you forever? Yeah. Being strong together? Yeah.
Heck yeah.
We're gonna do some fun things.
Yeah, I want to pause and just take a minute. Let me know in the comments below what you think. I know I've had a lot of comments in the past where people say, I would never do anything to myself. I would never change my appearance. Can't you be happy with who you are? Look, just because people want to make change, and obviously in this instance, you know, he's had car accidents. Still, you could say, well, that's just the way he is. He should live with it and just be happy. And obviously I'm a plastic surgeon, so I don't agree with that. I think that just because someone wants to change something about themselves physically doesn't mean that they don't love themselves. It doesn't mean they don't have respect for themselves. We all look in the mirror and we all have little insecurities, and not everyone is 100% confident what they see. If they can do some procedure or something to fix that, that completely restores the way that they feel on the inside. Everyone has the right to do what they want to do and to not be judged by that. I get emotional just seeing her get emotional.
And I hope when he looks in the mirror, he feels like that wish was granted.
Yeah, girl, you crushed it for him. She did an incredible job. And although he has a lot of makeup on, His scars look so much better. He feels better. His teeth look better. His function is better. His mental health is better. Everything is better. How could you not support that?
Smile back. But I have a whole lot more than that. The smile now seems like something so small. I've been getting that in my face in general.
And look at how much weight he's lost now. He's back outside exercising. He feels confident in his skin, which has led to other health benefits in his life.
Out there for every single person in the world? Yes. You're one in a million, but there's always another one in a million somewhere out there that'll be your yin to your crazy little yang.
All right, my friends, thank you for joining me on a journey with Skin Decisions. This is a great episode, and I feel like just a really good demonstration of allow people to be who they want to be. It is okay to do something for you. Health and wellness always comes first, and then anything physical that you're thinking about doing for yourself, it's totally fine. You don't need anyone's permission. You don't need anyone's validation. You live your life, and they can live their life. But for now, guys, Dr. Ricky, out.